I want to start talking to you about why smoking, tobacco use, nicotine use, these are important issues to talk to our clients about in physical therapy. So whether it's cigarettes, cigars, smokeless tobacco, e-cigarettes, these are highly addictive substances that have serious health consequences. Now, most of our clients know that smoking and nicotine products lower life expectancy, they increase the risk of heart and lung disease, but they may not think about that cigarettes affect blood flow to an injured tissue, they make physical activity more difficult due to shortness of breath, and they affect our immune system. All these things can slow the healing process and negatively impact the effectiveness of physical therapy. Now, we're seeing cigarette smoking at an all-time low. Only about 15% of adults smoke, and that's great. But what we do know that those who smoke, they tend to be more socially, economically disadvantaged, and they tend to be in poor health. We also know that e-cigarettes or vaping is growing in popularity, especially in teenagers. Tobacco and nicotine usage is one of the largest preventable causes of non-communicable diseases. This is an issue we just can't ignore in physical therapy. Our clients expect us to raise the issue of smoking, and smoking cessation is a vital part in improving the overall health of our society. So when we as physical therapists choose not to discuss smoking or nicotine use, we are in a sense condoning it. Most smokers want to quit, and we know that the more often a smoker hears a message in a supportive way, they're more likely to try to quit smoking. We have to be able to have these conversations with our patients. So when do we have these conversations? We should be asking about smoking and nicotine use during every initial examination. Now, that doesn't mean we jump right into addressing smoking the second someone says they smoke, but we can make note of this and return back to the subject when the time is right. This is a part of our patient management process. If a client says to us, they're interested in quitting smoking, or we hear some of that darn talk, that desire, ability, reason, need, we can continue the discussion. Even if the client doesn't show interest at first, we can use some of our behavioral intervention techniques to explore the topic more. Another great example is hospitals don't allow smoking anymore. So when we see a patient following a hospitalization, this person has already been through a period of forced cessation. This is a great time to bring up, are they ready to quit smoking? Are they ready to continue this? So we have the opportunity to talk to our clients about how smoking and nicotine use relates to their injury or condition. We should look for these opportunities to see if our clients understand that link between nicotine use and the healing process. Now, throughout this unit, you're going to learn about the 5 A's, the 5 R's of smoking cessation. We'll talk about medications and non-pharmacological treatments for smoking cessation. We'll talk about how to support someone during a relapse, and we'll learn about system-wide steps that can be done to support cessation programs. We'll also explore e-cigarettes and the issues around this newer form of nicotine delivery. So with this presentation and the application of techniques in our lab session, you will be ready to help talk to your future clients about quitting smoking and addressing nicotine products. I think you'll find this to be a useful unit, and I hope it's one that you'll apply throughout your career.